In a surprising move that has drawn both praise and concern, U.S. President-elect Donald Trump recently nominated Robert F. Kennedy Jr., the environmental lawyer and vaccine skeptic, to head the Department of Health and Human Services, the country's top health agency. Kennedy, 70, is a prominent member of the Kennedy political dynasty, being the son of the late Senator Robert F. Kennedy and the nephew of President John F. Kennedy. His nomination comes at a pivotal moment in the health and political landscape of the United States, stirring both excitement among his supporters and alarm from his critics. Robert F. is best known for his work as an environmental attorney and activist. He has spent decades fighting against environmental pollution, particularly from industrial corporations. However, his more recent public profile has been shaped by his vocal opposition to vaccination policies and his controversial views on public health issues. Kennedy has long been a critic of the Centers for Disease Control and Prevention, CDC, the Food and Drug Administration, FDA, and pharmaceutical companies.
The problem with RFK Jr.'s ideas is that they sound really good on a bumper sticker, but when you go one step deeper, it gets very confusing very quickly. Well, so look, the health secretary is an enormously important, powerful position. This is a person who oversees Medicare. This is a person who oversees our entire FDA, which makes all the decisions about medicine, CDC. RFK Jr. has demonstrated, I think, over decades that he doesn't understand the basics of scientific thinking and of rigorous analysis. He says things that are just flatly wrong, and he peddles in conspiracy theories. Having someone like that at the top of our entire national health infrastructure, I think is going to harm people. It's going to really harm the health of the American people.
He has positioned himself as a defender of individual rights and transparency in the public health system. Initially, Kennedy announced his intention to run for president in the 2024 election as a Democrat. However, in a surprising shift, he dropped his presidential bid in late August 2023 to throw his support behind Donald Trump, pledging to join his administration and serve as Secretary of Health and Human Services.
What about swing states? The answer is easy, no. No matter what state you live in, you should be voting for Donald Trump.
Trump has long spoken highly of Kennedy, calling him someone who cares more about human beings, health, and the environment than anybody. At a rally in October, Trump stated that he would allow Kennedy to go wild on health, food, and medicine, signaling the bold nature of the changes Kennedy might pursue as head of the HHS. Kennedy's most well-known slogan has been "Make America Healthy Again," reflecting his strong emphasis on health and wellness, albeit through a controversial lens. Kennedy's views on health and public safety have made him a controversial figure, particularly his stance on vaccines. Given the size and scope of the department, the appointment of its secretary is highly significant. The Secretary of Health and Human Services plays a crucial role in shaping U.S. health policy, overseeing health programs, and advising the president on matters of public health and medical policy.
The health secretary, again, has enormous influence. Certainly also will depend on who the CDC director is, on which vaccines are authorized and made widely available. But the one place where the health secretary specifically has influence is around coverage of vaccines and whether insurance companies will be paying for those vaccines or not, whether the federal government will supply it for low-income people or not. And if he makes decisions based on the way he's talked about these things, it will make it harder for all Americans to get vaccines and make it nearly impossible for poor people and lower middle-class working people to get access to vaccines.
He has long been an outspoken critic of vaccines, especially their safety and efficacy. As the chairman of the nonprofit organization Children's Health Defense, Kennedy has propagated various claims about the dangers of vaccines, particularly the assertion that vaccines cause autism in children.
Most health secretaries have not had a health background, and they have let the scientists at CDC, at FDA, at NIH make decisions. Kennedy's a very different flavor of a potential health secretary. He has very strong ideas, most of which are not rooted in evidence and data, and actually contradicted by evidence and data. He could end up having quite a large influence on what medicines are available to Americans. He could end up having quite a big influence on where NIH funds its research. Does it cover Alzheimer's, or does it cover obesity only, or what are the topics? He could end up influencing all of those things at least indirectly, if not directly. So I think this is potentially a very important hire. We will see what he does with the job, but I think anybody who looks at his track record is going to be concerned about where he's going to go next. Yeah, look, I think we're going to start seeing impacts relatively quickly, because if it looks like he's going to get across, you're going to see some of the best scientists at FDA, CDC, NIH starting to leave, because it's going to be very hard to work under somebody who doesn't basically fundamentally believe in the scientific process.
The Department of Health and Human Services is one of the largest and most important agencies in the United States. It oversees a broad range of health-related issues, from regulating pharmaceuticals to managing health insurance programs for vulnerable populations. The HHS is responsible for agencies like the FDA, CDC, and NIH, as well as programs like Medicare and Medicaid, which provide health coverage to senior citizens, people with disabilities, and low-income individuals.
No, I think the big picture point here is that a lot of folks see this as this is going to affect vaccines. In fact, it's going to affect everything. What Medicare covers, what preventive services are free. That is a decision of the health secretary. So our mammograms continue to be covered for free. Our colon cancer screening is going to continue to be covered for free. All of those are going to be decisions that fall to him. One has to be substantially concerned about his decision-making on those, because I think it'll have a big effect on people's lives across the country.
Kennedy's nomination to this post therefore holds the potential to reshape U.S. health policy in profound ways. However, Kennedy's nomination has sparked strong opposition from many Democrats and public health experts. Critics argue that Kennedy's vaccine skepticism and conspiracy-driven views pose a serious risk to public health, particularly at a time when the U.S. is still grappling with the aftermath of the COVID-19 pandemic. Senators like Patty Murray from Washington and Ed Markey from Massachusetts have condemned the nomination, warning that it could lead to policies that undermine public health efforts, particularly in vaccine distribution and disease prevention. Kennedy has also frequently criticized the FDA, accusing the agency of being influenced by the interests of pharmaceutical companies and Big Pharma. He believes that the FDA has allowed harmful products to reach the market due to corporate influence, which he sees as a major flaw in the regulatory system. His disdain for the FDA's role in regulating medicines and food has led to his calls for greater transparency and reform within the agency. However, his controversial views could also result in a more divided and contentious public health agenda. Ultimately, the nomination of Robert F. Kennedy Jr. to lead the Department of Health and Human Services represents a dramatic shift in the U.S. government's approach to health policy. Whether his leadership will usher in a new era of reform or undermine trust in the country's public health system remains to be seen. For now, the appointment continues to generate heated debate and uncertainty as the country prepares for the next phase of its health policy under the Trump administration.